Mr. Chairman.
Representative Gillen from New York.
Thank you, Mr. Chairman. Thank you, Ranking Member, for holding this hearing. Thank you to all the witnesses, again, who have held on for this very long hearing. Thank you for your testimony today. So I represent the South Shore of Long Island, which is adjacent to New York City. It is the home of legacy contamination, including in Administrator Lee Zeldin's district. We had the Gorman Plume and other legacy contamination throughout Long Island, where we've now seen cancer clusters, where like everybody on the block gets breast cancer, men, women, everybody. And we're also a community that has been devastated by the 9/11 World Trade Center attack. Pretty much, I would say everybody in my district who lived there at that time knows someone who was killed on that day or someone who has died since that time. So we talked a lot today about the need for expediency, but balancing with that the concern for human life and safety and concern for preserving our environmental beauty and our environment that supports all of our lives. And Dr. Myberg, you talked a lot about we have to make a value judgment about rushing and the cost of rushing and how that could have a much more devastating impact than the cost associated with waiting. We saw that with 9/11, where the EPA administrator at the time came out right away and told everybody, don't worry about it. The air is safe. You're all fine. Go back to work. I understand we wanted to get the economy going again, but as someone who worked blocks away from the World Trade Center, now I have to worry. And now we've seen my friend's husband who worked on the pile and was told that it was safe to do that. And he's dead. And there's a whole new branch of science about 9/11 related cancers. So my question, I guess, would be first to you, Dr. Myberg. How do you weigh the costs? How can the EPA effectively weigh the costs of expediency? Because yes, I want to win the space race, but I don't want my neighbors, my friends, my fellow Americans to die because something was put out there that they were exposed to. And now, again, with 9/11, every day I have to fight here to fund the World Trade Center health program because we still don't know how many thousands and thousands of people might develop one of these cancers.
Thank you very much for that question, and it sort of illustrates the dilemma that I think this committee has been struggling with, and I think on a bipartisan basis about how to make these kind of balance and judgments, because I think, knowing that the official who was the administrator at that time, I think if she had it to do over again, she would have expressed herself somewhat differently, because there clearly are and continue to be real risks. At the same time, there is something to be said about the need to make decisions, and you have to simply do the best you can. You try to derive, as Charlotte said, you try to make the process work as reliably and dependably as you can, and then to make sure that in that process you have access to the best information you can get, and then make the decisions you have to make at the time. In short, for example, in the case of Superfund, you sometimes do short-term removals just to mitigate the immediate risk, but the long-term thing to mitigate long-term risks simply takes longer and more planning. And the best way you can do that is to get the best possible talent you can get into the agency to do the objective assessments to make then those judgments that are based on the best science that's available, as everyone has said. And so my principal concern with this is simply to protect and preserve the integrity of the agency in setting up a structure that makes those decisions based on science. And that's, in some ways, to me, at the heart of my testimony, is that the agency's role that has been given by Congress is a critical one, and you want to make sure they're as well positioned as they can to make difficult judgments.
Thank you, Doctor. And so I joined this committee because it tends to be one of the most bipartisan committees, and I do think we've heard some consistent things, despite some of the back and forth today, that there needs to be more investment and more resources with the EPA. I think all of you agreed with that. We need to make sure that the EPA has the proper resources to execute its job. We want to streamline processes. Certainly, I think, Dr. Myberg, you also talked about, or somebody else talked about, redundancy, where there are different standards, and sometimes that can actually frustrate industry even more. I know in New York, I think we have among the most stringent PFAS standards, which may not be the same in another state, so that might make all of your jobs in the private sphere much more difficult. So is there a way we can convene experts like you to try to create a way where we can all be happy, where we know that we are streamlining the processes, eliminating redundancies, but yet making sure we're taking the extra care to make sure we're not going to be releasing contaminants. Because from the corporate perspective, that's not helpful either, because you'll be bankrupt if something goes the wrong way.
The gentlelady's time has expired.
Thank you.
So